Welcome back to the Better Health Now podcast. Today I have the opportunity to sit down with Dr. Greg Thompson, a general surgeon and robotic surgery physician here at Cullman Regional. Thank you so much for joining me.
Thanks for inviting me.
Yeah, I'm excited to kind of dive in and talk about the topic of the Vinci robotic surgery. But before we talk about that, talk a little bit about your journey to get here to Cullman and where school and the pursuit of medicine kind of took you.
Yeah, so I was born and raised in North Alabama, just hour north of here, really, in Madison, Alabama. Spent my entire life there until college. I went to Auburn and then made the journey down to Mobile for medical training at South Alabama. Spent 4 years down there and then brought me back to Birmingham, where I did my surgical residency training for the last 5 years. And then right around 2020, during COVID is when I completed that and moved to Cullman. We've been here ever since for the last 4 years.
Oh, wow. Okay. So the topic of the robotic surgery is something that I'm excited to talk about. It's something that I don't know much about. How does this Da Vinci robotic surgery system work? And does it require any special training or certifications beyond what you've already had?
Yeah, so it's pretty remarkable what it can do. If you think about it, it's they call it a robot, but it's really an extension of the surgeon's hands more than anything else. So what we've had for the last 20 years of laparoscopy surgery, or minimally invasive surgery, what they used to call it, was basically, you think about chopsticks, just for lack of a better way to do it, you can only move your hands in this direction like that, and it was always straight. What the robot has really been enabled us to do is it allows us to almost have our hands inside the patient's body with not actually doing that, still doing it minimally invasive through small little poke holes that are about the width of my finger, and it gives you articulation of the wrist of the joints where previously you could not bend your hands at all, and so you had a point and just had to go this way in the surgery. Now you can literally have 7 degrees of freedom, and you can rotate your wristed hands inside the patient more so than you can do with your own wrist outside the patient. So it gives you so much more movement. The precision is just unbelievable compared to what we used to have in laparoscopic surgery. The robot itself gives it to us in 3D versus old version that was 2D for laparoscopic surgery. So it's just up the ball game in every aspect of surgery, making things more precise, making surgeries that we couldn't do in the past laparoscopy wise. We can now do it robotically, or surgeries that were very difficult to do laparoscopically are now a piece of cake to do robotically, just because it enables us to do so much more. We have more control as the surgeon. We have total control of the entire surgery. The camera itself, it does not move. We move it when we want to. The robot does not move until we move it everywhere it goes. So it's not like we hook the robot up and it takes over at that point in time. That is not the case at all. We hook the robot up, we go to a console, sit down 2 feet away from the patient, and everything we do is what the robot mimics identically to us.
Wow. And so how new of a technology is this Da Vinci robotic surgery?
So the Da Vinci, or Intuitive is the brand. They've been doing robotics for about 15 years or so now. The Da Vinci Xi robot's been out for probably about 10 years or so. It really started to catch on over the last 5 to 8 years, mostly in that time frame. So right during my training is when it really picked up full bore. And so now it's basically what everything's going to at this point in time. Anything minimally invasive is almost all going to robotic surgery.
So when you were in UAB, you were able to kind of even use this practice and the Da Vinci methods prior to even coming here to Cullman.
Hold that. It was at Princeton Baptist, not UAB, Princeton Baptist in Greenville. I don't know if that would matter at all.
Yeah, but I'll read it. So when you were at Princeton Baptist, this technology of the Da Vinci robotic arms was something that you actually were able to kind of work on while you were going through that time, or
Definitely.
is it? And then as you've come here, the opportunity to continue that skill set is something that you've been able to do.
Yeah. So down in Birmingham, I had the opportunity to train under some of the busiest robotic surgeons in the entire Southeast at Grandview Medical Center and Princeton Baptist Medical Center as well, doing some very in-depth robotic surgeries. And the training for it is very in-depth during your residency program itself. So probably had 800 case log as far as cases that I was in on, learning how to use the robot before I actually got to get on the robot and use it myself and train on it. And then coming here, felt completely confident to start out doing it right off the bat. But there's a lot of surgeons that didn't have that training in residency. They've already been out, and so now they're trying to relearn how to do the robot after already going through it. So it's a different program for them, but they do all have to go through a rigorous program as well in regards to training how to use the robot at the patient's bedside as well as at the console, doing simulations beforehand as well. So there's a lot that goes into it.
Yeah. And so is there any benefits for the patient that if they use the Da Vinci system for surgery versus a traditional surgery method?
Yeah. So it's proven minimally invasive, especially with the robot itself, less pain, shorter lengths of stay, and quicker recovery as well. All three have been shown with the robot minimally invasive surgery. So I've seen that time and time again with majority of our patients. A lot of times we'll send them home and they won't even use their pain meds because of it and stuff. So I don't want to say it's all due to the robot itself, but we have a great anesthesia department that does great with pain control as well, but it does help tremendously.
Yeah. And so what are the typical surgeries that you do and that you perform with the Da Vinci?
So myself, pretty much anything in the abdomen we can do, we're gonna try to use a robotic on it because it just enhances everything. But colon surgeries, hernia surgeries, gallbladders. We do bariatric surgery here the same way with our stomachs. Any kind of hiatal hernia repairs, solid organ removal, all those, anything that's in the abdomen, we're usually going to do it robotically. And that's something that is great about Cullman Regional is they've embraced the robot significantly since I got here, because there's a lot of places that only allow surgeons to use the robot on weekdays for elective surgeries. But here at Cullman Regional, they've allowed us to instill that into our weekends for acute care surgery as well. So if a patient comes in with a very bad gallbladder or a very bad appendix, anything like that, we are allowed to use that. And all of our teams are trained up on it, how to use it specifically, all of our scrub techs and whatnot, to where we can use that and utilize it 24/7, 7 days a week, basically. So it's perfect in that regard, because it used to be on the weekends, you still had to go back to doing laparoscopic surgery, and you go from doing something that's so amazing on this platform and then having to do this on the weekend. It's a complete drop off. So they've embraced that, which I thank them for that, because we can use it at all times now.
Yeah. And so as you're talking with patients, what is their response for when you talk about using the Da Vinci robotic surgery? Are they aware of what that is? Are you kind of having to inform them and teach them like you are today? Or is it something that, it's become such a more of a common thing that you're not really having to educate on?
Yeah. So I think they've all heard of it. They'll say, are we going to be using the robot or something along those lines? Or they've heard of the robot, but they don't really know what that entails or what that is and stuff. So I try to give them a little idea of it. I always let them know that the robot's not doing the surgery. I promise you that. But I do let them know that it is basically what it is, an extension of the surgeon himself. So the robot's only going to do what we instructed to do with our own hand motions and whatnot too.
So is there questions that patients typically come to you, or that you think patients should be asking their general surgeon when their surgery is recommended to use Da Vinci?
Yeah, I mean, in regards to the robot itself, I don't know if there's particular questions in that regard, because if they've been trained on it and they've been checked off for it, they're going to know how to use that. I think more so questions in general they should be asking their surgeon, and and it should be on the responsibility of the surgeon to tell them a lot of these things themselves as well, but ask them what the surgery entails, what they can expect to feel afterwards, the recovery period, all those sorts of things. The surgeon should go over those in a manner that they can understand easily, but just like they're going to ask questions if they hire somebody to do something else at their house, they're going to ask them all sorts of questions about it. Ask anything you can think of at that point in time. Google search your surgeon, look them up. I mean, if you hire somebody to do something around your house or anything else, you're going to look them up and look for recommendations, that sort of thing too. You can do the same thing now on the internet. It's very easy to look people up and find out what other people are saying about them and stuff too. And so you can get some good insight about that from your surgeon or about your surgeon online too.
Yeah. And I think, it's surgery of any kind is always kind of a scary thing. So having as much information, being well informed, leading up to that process, and also in that process that patient's experiencing, making sure that they understand everything along the way. And it's amazing just to think that the Da Vinci allows for a quicker recovery and all the benefits that we talked about earlier. What feedback are you getting from your patients when they come for their follow-up appointments when you use the Da Vinci?
Yeah, so that's one thing is how quickly they got back to work, the amount of pain meds they didn't have to use, or if they used them at all, that sort of thing. Small incisions are great. The way we're allowed to do the surgery with the robot as well is it's through poke holes about the width of my finger, usually 3 or 4, depending on what the surgery is. But it allows us to put those in different areas that we can hide scars as well too. So that's a big thing for a lot of patients, as well as wanting to hide scars from being across your belly. Sometimes you can hide them along panty line or along the side of the abdomen instead, so you don't have incision marks on the front side of your abdomen and stuff. So some people care about that thing, so we're able to cater to that sometimes as well.
Awesome. Well, I appreciate you taking the last little bit talking about the Da Vinci robotic surgery that you perform here at Cullman Regional. It's pretty incredible that is something that is being done here, and it's incredible that benefit is available for your patients. I continue to look forward to the impact you're going to have in your patients' lives here at Cullman Regional for years to come. But thank you so much for being here.
I appreciate it. And that's something you just hit on perfectly, is the fact that a lot of people don't know about Cullman Regional having that stuff here. So a lot of patients that go down to Birmingham or Huntsville for these sorts of things, when they don't realize they can come 2 miles down the road and get it done here in the same day and be gone the same day, and they don't have to deal with everything else of traveling back and forth to Birmingham and Huntsville and stuff. We have all that stuff here now. So that's something we're trying to get out to the population, to let them know that all that's here at Cullman now.
Yeah. Well, I appreciate you being here today.
Thank you. I appreciate it, man.